Dr. Thompson, Akwo, Ntuba, international physician, certified global health professional and expert, USA. COVID-19 updates. COVID-19 updates. In the meeting today with the Director General of the World Health Organization, Dr. Tedros, Dr. Ryan, and the other experts, it's been said that COVID-19 new cases or incidents are rising in 5 of the 6 WHO regions around the world. And there is increased hospitalizations and increased mortality. And there is the fear of healthcare systems around the world being overwhelmed that will leave governments without any other option but shutting down whole nations again. And so the WHO continues to caution and to advise countries and individuals to continue to know that the world is not out of the woods and that COVID-19 is ongoing. It is actually said that there are questions around a mix and match issue, which is to say that people are actually asking if they can mix the vaccines. If you took the mRNA vaccine, can you actually mix a Pfizer or Moderna vaccine maybe with a J&J vaccine? And people have been told to understand that there is no scientific data or science-based evidence to back that in the scientific literature around the world so far. And so the studies are ongoing for the need, if possible, for mixing and matching. But the other thing is the booster. And the people of the world are being advised properly to understand that it is unfair to be talking about booster when there is no scientific evidence and data that says that the 2 doses or complete vaccinations of the acceptable WHO vaccines that are in circulation are not working. That is in 6 months, in 1 year. While there are countries and continents that have not even started vaccination in some countries, we cannot be talking about booster doses for people and nations, especially the advanced and rich countries, are made to understand that, yeah, there may be a time when talking about booster, maybe in 1 year or 2 years after, that will come up. But not at this particular time, because the booster dose issue may be driven by pharmaceutical companies that are producing the vaccines. The question of Indonesia, whether people should pay for vaccines, was addressed, and it was said that it could raise ethical issues and equity issues. And since some of the vaccines are contributed freely through COVAX and other facilities, nations are encouraged to make sure that they also give them free to their population so that their healthcare workers and the more vulnerable can be vaccinated. Risk management was discussed. Besides the fact that COVID now is being looked like a 2-track or 2-tier issue, where the rich countries will end up saying that they are vaccinated their population, COVID-19 is not their problem, and they may ignore the rest of the world. But the Secretary General has made it clear that that attitude is wrong, for nobody is out of the woods, and variants may also cause problems. Some of the drivers of the pandemic today so far are said to be the virus variants, low vaccinations globally, and increased social